Hello, everybody, and welcome to our live session today with Dr. Sian. I'll be going over a quick startup presentation to welcome you all and introduce you to our program, opportunities, if you previously attended our shadowing session. You know that Priel Shadowing is a student-led, minority-led, women-led nonprofit dedicated to helping prospective healthcare professionals gain access to educational resources no matter their demographic status, ability, or location. My name is Hannah, and I am the Chief Volunteer Coordinator here at Priel Shadowing. Thank you all for attending today, and let's get started. Just a little pre-SA, we have closed captioning for all of our sessions to accommodate all students. The setting is available at the bottom of your Zoom session screen. If you need assistance enabling the transcript, please direct message one of my team members, and we'll be happy to help you. So since this is an international program, we'd like to know where you are joining from us today. Please drop it in the chat to see where we are all joining from. We got a wide variety of people today.
Wow,
nice.
Very nice.
We are always looking for ways to be more inclusive and ensure our sessions are available to accessible to everybody. So if you have any recommendations for how we can improve, please let us know by emailing info@prielshadowing.com. That said, now, if you want to stay in the loop with us, we are also on Instagram and TikTok, as well as email. So feel free to follow us at Priel Shadowing. We have some wonderful opportunities for all Priel students as benefits as being part of our program. We have partnered first with Kaplan to get you guys a 10% discount on discount code that can be used on all Kaplan products, as well as free resources such as study guides to help prepare you for standardized tests like the MCAT, NCLX, or the PCAT. If you fill out the short survey in the chat that's linked right now, you will get hooked up to this, so it's a great resource, and I highly recommend checking it out. As well, we also have a partnership with Neolith. Neolith is an online mental health program for students and and young adults. College and young adulthood is stressful as enough in non-pandemic times. And for Priel students especially, we know that this path isn't easy. That's why we partnered with Neolith to give you guys free access to their services. If you use the link in the chat or enter the code PREHEALTH when signing up, you'll get a discount. And yeah, this is a great opportunity. I encourage you to check it out. Check out the links in the chat below. Next up is Mask for Masks is an amazing women-led organization that donates 4 masks for every 4 masks sold. These go to people in need during the COVID-19 pandemic, those in the homeless community, healthcare workers without proper PPE, and others who are struggling to stay safe. So with our discount code PHS15, you can get 15% off your order. If you buy through this method, Priel Shadowing will also get 10% of the proceeds, which is amazing because we are also a nonprofit that runs solely off of the support and help of our students. If you want to play a bigger role in being part of PHS, we would love you to join our network of student volunteers and team members. You can apply to be part of our administrative team and lead student-led projects, initiatives, professional outreach, grant writing, and more. We also understand that as Priel students, you may not have the time to be a volunteer, or a Priel student team member. So we also encourage you to join up in our volunteer team. We have opportunities that you can do asynchronously on your own time, and we'd love to have you be a part of our program and continue to contribute to our unique perspective. If you're a high school student, we also have opportunities for you. We'd love you to get involved with our program through our high school training program, which allows you to connect with college pre-health programs and get involved with fundraising for Priel Shadowing, organize resources for other high school students interested in medicine through our program. You can sign up through this link as well. If you're looking to get published, we also have opportunities for you as well. You can use the chat in the link. We'd love to hear from you, either writing through articles, reflections of why you're part of Priel Shadowing, reviews of our program, as well as success stories and your journey as a Priel student. You can submit your writing submissions through the link in the chat. A part of our mission at Priel Shadowing is also to promote diversity, and in order to do this, we have launched an initiative to have monthly panels to celebrate different demographics in the field of medicine. Some of these upcoming events include an all-female pattern for Women's History Month, a COVID-19 roundtable, International Student Forum, and many more. If you have a mentor professional that has inspired you and think you can contribute to these conversations, we'd love you to nominate them so we can hear from them and get to know more about our diverse pre-health community. Throughout the session today, we love you to support us We are a solely nonprofit organization. We humbly ask that you donate to our program. We are completely student-run. We're working around the clock to keep this free and accessible for everybody. And unfortunately, our Zoom and website aren't not free. So if you can contribute anything, we would humbly appreciate it. And if you're financially not able, we ask that you share this link on the QR code to any of your friends or family to see if they can help us and support you in your pre-OS journey as well. Thank you so much. Throughout the session today, feel free to type your questions in the chat. We will make note of them and ask them to our professional at the end of the session. As well as take good notes, because after this session, there is a quiz that you can earn a certificate for your shadowing hours. And we'll more on that at the end of the session. My final note is if you can have your cameras on, please do. We want to make this as close to a true shadowing experience as possible. We know it's not always possible, but a little face-to-face interaction can go a long way. And all right, that is it for me. I appreciate you listening to me, and I would like to welcome our professional, Dr. Sian, today. Thank you so much for joining us, and please take it away. Stop my share.
All right. Hello, everybody. How's the audio? Hannah's fine? You can hear me? Okay, great.
Yeah, sounds good.
And can you tell me how much time do I have allotted for this?
So you have about 45 minutes, but take as much time as you need.
Okay, good. Good to know. Good to know. Awesome. Well, thank you everyone for joining, and thank you Pre-Health Shadowing for having me. Really, really impressed by everything you guys are doing, honestly. I think I just did another little shadowing thing like last week. That was my first experience with what you guys are up to, and really just thought it was so cool, and love that you guys are taking this initiative. And I saw there's so many people from all over North America. That's awesome too. A few Canadians in the crowd. Yay, go Canada. I'm going to jump right in. Should I share my screen, or is it shared already? It's not sharing yet.
Yes, please share your screen.
Okay, there we go. As Hannah said, please feel free to throw your questions in the chat. If I miss them, I'm sure one of the amazing team members here will alert me to them. I'm going to try to make this as sort of as much as interactive as possible, and I want to give you guys just a little taste of what the different things we might do as optometrists. Obviously, it's not quite the same as you being in the office and seeing a person right in front of you, but at least I want you to know the different types of cases we might see, and the different types of conditions that we're looking for on a day-to-day basis as well. So again, my name is Harbir, Dr. Harbir Sian. I live and work in the Vancouver area, and I have two optometry practices. I'm co-owner. I don't know if you can see my cursor with this lovely lady who's standing next to me. And there's a few other team members who are not in the picture, but we have a few associate doctors and of course staff members who help the office run. One of the offices we have is a sublease practice. We're going to touch a little bit on what sublease practices are about, next door to a Lens Crafters. And the other practice is an independent private practice. Again, we'll touch on a little bit about the differences there. I personally like to make everything I do as enjoyable as I can. I don't often have the Easter Bunny come in for eye exams, but when he does, I do make sure to take a picture. I like to be on social media. I like to interact with students and other ODs and other people who are interested in the profession, as well as patients. It's been an interesting way to engage with patients. But one of the things that I'm truly passionate about is giving back. And I volunteer in multiple organizations as well as our provincial association. This particular picture that you see here is from a trip that I did in Jordan in the Middle East. We were providing eye exams and glasses and those types of services to refugees near the Syrian border. So that was obviously a very impactful experience, life-changing experience. I've done a few trips like that with one site, also in South America, and some other clinics in the US. And we have an organization here locally that does some similar things I'm on the board of, which is called the Eyeglasses Project. And same idea, we kind of hold these clinics and provide eye exams and glasses for people who don't have access to care, like homeless and others. So that's obviously very fulfilling. It's not written on here, but I do have a podcast, shameless self plug here. if you're interested in learning more about optometry, it's not, I don't always interview optometrists, but people from other industries, whether it's medical professionals, whether it's business people, I try to get their perspective on what their life has been like and what their careers have been like. And I feel like it's a really, I learn a lot. So I imagine anybody else who's interested in the profession or just self-development in general, there's a lot to be learned there. And I also will, so once in a while, I'll put out some solo episodes where I'm just talking a little bit about my experience. And in fact, talking about fulfilling experiences, the last episode I just posted this week was about 5 things that I've done in my career to help keep myself sort of motivated and fulfilled. And obviously giving back is one of them. If you want to check it out, it's called the 2020 Podcast. Look it up on Apple Podcasts and Spotify. One thing you'll see, one obvious difference I think is obvious in these pictures compared to who you're looking at in the camera right now, is that I'm wearing this turban. And this is actually, I think it's perfect, Hannah, of the focus that you put on and PHS puts on diversity and inclusion and everything else. I'm Punjabi, my family's from India, and we are Sikh. I wasn't actually planning on talking about this, but your little spiel in the beginning kind of inspired me. One thing I'm trying to do just to kind of get a little more connected to my culture recently is to start wearing a turban just from time to time. This is actually only the second time I've worn it in the last month or so, and a second time other than my wedding day. So something that I'm doing just to kind of try to be a little more connected to our culture and our community. And I would encourage you, to not only be connected in your own community, but also share, stories and other learnings and stuff from your culture and that with other people to help everybody kind of to be more inclusive. I think we need a little bit more of that these days in all of our hometowns and cities and countries. So anyways, I won't spend too much time on that. Let's actually talk about optometry. So there are a lot of different modes of practice for optometry. I already touched on 2 of them for myself. The first one being private practice. And private practice is what you might think of as your kind of most common, most traditional, conventional way of practicing. You have a standalone clinic, you see the optometrist, you get your eye exam, and out front, they'll likely sell glasses. Everything's just done in-house by that one company, by that one clinic, by that one doctor. I'll go through these kind of quickly. And then of course, if you have questions, ask me now or ask me later. Corporate has a few different variations. Sublease practice, like I touched on for our practice, which is, in our case, it's next door to a lens crafters. In other cases you might have seen, it's actually within the lens crafters. That's what often is referred to corporate. There are also settings, within Target, within Costco and other settings like that. Those are all considered corporate, but there's other settings that are not quite as obviously corporate. So in the US, I know My Eye Doctor is a pretty big brand. In Canada, FYI Doctors is a pretty big brand. Iris. These are actually, they look like the standard private practice standalone clinic, but it's actually a corporate setting because it's sort of run top down. There's a head office. The head office gives direction to all the clinics to run a certain way, to look a certain way, to be all rebranded the same. So that's kind of a different version of what corporate optometry looks like. In those other settings, in all of these settings, majority of the settings, there's still some autonomy, right? You're not always just run by the company that's overseeing everything. There's still autonomy for the optometrist to run things the way they want to run them. Especially in our case, our practice is actually independent of lens crafters. Lens crafters has no say in our practice, but we have obviously a mutual relationship with them. They send us patients, we send them patients, and back and forth. There's definitely, when I was in optometry school, there seemed to be a stigma around corporate practice. And there still seems to be for a lot of people, but there's a lot of great things that you can do in a corporate setting. Can be kind of like a easy way to get your feet wet, sort of a turnkey setup. You walk in the door, the practice is ready to go. There's a lot less involved upfront, but you can still practice the same way, full scope optometry, as you would in a private practice setting. Ophthalmology, so optometrists can also work side by side within an ophthalmology practice. We'll see that here in Canada. I know for sure in the US, they'll work side by side, OD, OMD practice. And in those cases, you'll probably end up seeing a lot of a disease and you know, co-managing with the ophthalmologist, great if that's the kind of thing you want to go into. If you want to be more disease-oriented, more medical practice, the ophthalmology setting is really good for that. I did a clinical rotation in an ophthalmology clinic, and really, really cool experience to see so many different types of disease, way more than you'll see in a private practice, of course. Specialty practices are becoming bigger and bigger these days, I think. And that's essentially, you know, you're taking one area of optometry or eye care and you're really just delving deep into that and not doing a whole lot of the other stuff. So in a private practice, you're sort of doing general care, you're doing eye exams, you're checking prescriptions, you'll see the you know, people who have eye infections, you can co-manage certain eye diseases and such. But when you do a specialty practice, you're really just focusing on that one thing. So different types of specialty could include dry eye disease, which is a pretty big one these days. So I have a couple of colleagues who really 90% of what they do is treat dry eye. They get referred these patients who have these chronic progressive, you know, conditions that don't seem to be getting better with the traditional conventional treatments. They end up in that practice. Contact lens, specialty contact lens practices, and myopia control is a big one these days. If you're not familiar, we're going to touch a little bit on some of the basics of eye care in a minute, but myopia is nearsightedness, which means you can't see very well far away. It's something that's really, really, the prevalence is increasing significantly over the years. I think it's predicted that by the year 2050, literally 50% of the world's population will be myopic, which is kind of mind-blowing if you think about that. And we're seeing more and more younger and younger patients, kids who are becoming nearsighted at much earlier ages. So we're finding that there's a specialty there, new treatment options to help kids to prevent it from progressing too much in the future. There's the option in the US. I don't believe in Canada there's so much of an option for military, but in the US, of course, you could do, you know, a few years of service practice within the military, whether it's Air Force and Navy, Army, whatever it might be. And then the VA practice is an interesting setting as well. There you're working within a VA hospital, treating patients, again, veterans, and likely, in my experience, I did a rotation at a VA hospital. You tend to see a fair amount of disease as well. These patients are generally older, not quite as healthy. So again, a little bit more of a specialty type of setting in the VA. So you're probably interested where you're at now, you know, pre-medicine, pre-optometry, and that type of stuff. You're probably interested, what's the process of school? So there's a lot of different, there's a good number of universities across North America, majority in the US. Last I checked, I think it's 23 or 25 schools, colleges, and universities in the US. There's 2 in Canada. Really, there's only 1 in Canada, unless you speak French. There's one, Waterloo, which is the English-speaking university, and there's one in Montreal, which is French-speaking, only French-speaking. And then, of course, the 20 plus across the US. That number has grown a fair amount since I graduated now, which was 10 years ago. There's probably, I'd say, at least 5 new universities since I graduated that have popped up. And before that, there were really no changes for a long time. So there's more opportunity to get into school. I would say on average, class sizes kind of range from 80 to 100 students. The program is, you probably already know this, it's a 4-year program. 3 years of that is academic or didactic. So you're in class for 3 years, and then the 4th year is clinical. And in those, you know, that 4 years, you have the quarters, you're working in that 4th year, you're working in 4 different settings throughout the year to get your clinical experience before you graduate. The type of courses you can expect to see are, I think, pretty much what you would expect from any kind of medical field, right? You're going to do anatomy and physiology, biology. One of the biggest ones is optics, obviously. For optometry, optics is huge. And I've had a few students, pre-optometry and even optometry students, reach out about their fear of optics. And I just want to put this out there that I hated physics and optics through high school, through undergrad, just despised it. So not sure exactly, well, I'll tell you how, but how I ended up in optometry, where optics was kind of the big focus. But the interesting thing is, I eventually started to love physics and optics. And it's when you kind of start to understand the basics of it. With physics, once you understand some of the basic rules and laws, you can reapply those in so many different ways. It's actually not as hard as it initially seems. But optics obviously would be a big one. And then you spend a lot of time doing pharmacology, because we need to know the interactions of drugs that we're prescribing with other medications that patients might be on. And of course, anatomy, I mentioned that already. But then, of course, disease. So we spend a lot of time on ocular disease and overall systemic disease as well, because our eyes are connected to the rest of our body. So it's important to know how all of these conditions can interact. And we're going to touch on some of those conditions. Clinical rotations. There's a lot of different opportunities in different settings. It's really cool to kind of dabble in each of them before you graduate, so you get a bit of an idea of what you really like. I did a rotation, as I mentioned, at an ophthalmology clinic in Florida. I did a rotation at a VA hospital in Portland. I did a community health clinic in Boston. And my last rotation was actually back here in Vancouver at one of these corporate kind of settings / private practice settings, where that's where I knew I always wanted to come back to. So it was nice to have that as my last one. Once I had all the other settings under my belt, I could come home and really start to understand how I'm going to integrate all of that into the way I'm going to practice here. Residency is something that I'm seeing over the years. It's gradually gotten more and more sort of popular. Not that it wasn't popular before, but I see the benefit of that. You spend 1 year after optometry school in a residency that you apply for, and it allows you to specialize in a certain area. So that could be ocular disease, contact lens, whatever it might be, whatever setting you choose. And it's a nice way to really get more specialized or more experienced in a certain area without so much of a risk of having to do it after you're in your own practice. And I see a lot of people now, a lot of colleagues who've done residencies really benefiting from that experience. I personally did not do a residency. I was eager to get back home and start working right away. I was afraid, and I'll share a quick little personal thing here. I was afraid that that 1 year that I was going to be away was going to set me back a lot. You know, I was going to lose the income for that 1 year. I was going to lose the opportunity to get a new job, get a certain job at that 1 year. But after practicing for 10 years now, I see really that 1 year, it's such a small thing in the grand scheme of things. And if you can use that to specialize, it's probably not a bad idea. Because these days our profession is moving more in the direction of having that specialty care. And if you have that specialty care under your belt or that experience, that can help separate you from other practices and other settings. Okay, so let me give you a quick tour through one of our practices, just so you get the bearings. You probably have already been into an optometry practice or had an eye exam at some point in the past, or you might have even done a little bit of shadowing. This is the front end of our practice, Clarity Eye Care. This is the private practice. Things have changed now. This picture is a lot older now. With COVID, we've moved a lot of the stuff out of the way. We don't have people just sitting around and sitting close to each other anymore. And of course, we have a lot of plastic barriers up everywhere, which doesn't make it seem quite as welcoming, but these are the times. This is one of our pre-testing rooms. It's a little tight in this picture. We've moved things around since then, but you'll see a few different pieces of equipment. I'm gonna see if I can put on can you see my marker here? So just a quick little thing. This is an old retinal imaging machine. We don't use this one anymore, but that's one of my favorite tools, taking pictures of the back of the eye. Back over here, this is a lensometer. This is what helps us measure somebody's current glasses. We can see what their prescription is. And these are a couple other pre-testing. If you've had an eye exam, this is the notorious air puff machine. Everybody hates this one. And then this guy back here is the autorefractor. This gives us some early measurements of what your prescription might be. And we take those numbers and use those to start to actually check your glasses prescription. Now that I got the laser pointer, this doesn't work. Quick view of the inside of the exam room. This little machine back here is probably the most recognizable machine for us. This is the Phoropter. This is what we do, which is better 1 or 2, help you check your prescription. Just off to the side here is a slit lamp. This is basically a microscope that helps us examine the health of the eyes more closely. There's a bunch of other stuff that's not in this picture. Over time, as I mentioned about specializing, we've tried to specialize a little bit more in a couple different areas. Bought a few different pieces of equipment to get into these other areas of myopia control and dry eye and stuff like that. So this is another picture of the retinal imaging. We're definitely going to look at this kind of picture a lot more over the next few minutes. This is a picture of the retina. That's the eye exam. This is a fun little picture. This instrument that I have on my head here is called a BIO, binocular indirect ophthalmoscope. Easy for me to say, right? And then this lens is a 20 diopter lens that we use to focus the light into the back of the eye so we can see the retina. All right, let's talk a little bit about ocular anatomy before we start talking about some cases and diseases. So again, I apologize if some of this is redundant for you guys, but I think it's important to quickly go over it. This is a cross section of the eye here. The front of the eye, that clear dome is called the cornea. Just behind that is the iris, which is the colored part of the eye. Just behind that is the lens. It's literally called the lens, but it is what is responsible for us able to shift our focus. If you think of about a lens on a camera where you can change the focus from near to far, that's what this lens does here. And then the entire orange layer back here is the retina, which coats the entire inside surface of our eye. And retina is where vision begins. Up here in this blue image, you'll see the retina is actually made up of many different layers, 10. I think it's 11 now. I have to check my recent studies. But anyways, we generally would say 10 layers of different cells that conduct that initial stimulus of light or an image landing on the retina and send that to the brain where technically vision actually happens. And this is what we see, this nice kind of orangey, peachy color that you see here. This is what we see when we look through the slit lamp or that BIO, or when we take a photograph. This is what the retina looks like. And really one of the most what's the word I'm looking for here? Impactful moments of my optometry career was actually right in the very beginning when I saw this picture, beginning of optometry school, I should say, when I saw a picture like this and I saw multiple varieties of this picture. I just thought how cool it is that we can see the inside of the eye, and the optic nerve, which is this little yellow thing here that extends out the back of the eye, is actually a part of the brain that plugs into the eye, not the other way around. It's not the eye that's connecting to the brain. It's actually a cranial nerve. So it stems off of the brain and then plugs into the back of the eye. So what you're actually seeing when you look in the eye is a part of the brain. It's the only way in your body that you can just look inside and actually see a little piece of the brain. And we'll see how that can actually be influential when we're making certain diagnoses. And then you see all of the red lines. These are all the blood vessels, the veins and the arteries. And these veins and arteries are directly stemming from the brain, which are of course coming from the heart. So again, the only place in the body where we can see veins and arteries in their natural environment, and actually can be quite helpful for us to pick up early signs of certain systemic conditions. Oh, I keep forgetting that doesn't work. Okay, so I thought about talking to you guys about certain types of cases and conditions, and there's a whole whack of some of the basic ones that we see, pink eye and allergies and conjunctivitis, which is just like an infection or inflammation of the ocular surface. But I thought I'd go kind of into some of the bigger ones that we see, and maybe some that are not ones that you thought about. So a common one that you've probably heard about is cataracts. Cataracts affect this lens. Remember that lens that helps us change our focus from near to far. Over time, that lens becomes cloudy, and that's just really more so an aging change that will happen over time. It's rare that you'll see one this dense that is this white, although this is what a lot of people will picture when they think of a cataract, is that white central portion of the eye. When it gets cloudy, it affects our vision. We can't see quite as well. We lose contrast. And the way a cataract is treated is actually to remove that lens with a surgery and replace it, implant a new plastic lens in its place. And it's pretty amazing how far cataract surgery has come over the years. They literally used to have to make an incision that was half of the diameter, or the circumference of the cornea, and then slide a large item, knife or a scalpel or something similar, extract the lens and implant a whole lens through that half, circumference incision. And over the last 20 years or so, of course, that's changed dramatically. They started making an incision that was probably about 6 to 8 millimeters wide. And now they, in fact, make a couple of incisions that are only a couple of millimeters, one up here and one over here. And they can insert little tools that are super tiny, and they actually can roll up the lens and it inflates when they insert it into the sac here inside the eye. So pretty amazing. I've been fortunate to be in the operating room for a bunch of those, and it's really cool to see how well that goes. And the results are pretty amazing. So we do a lot of co-managing. If we see a patient who has cataract, we will refer them to the surgeon, and after they're done their surgery, they come back to us for all their follow-ups, and we'll monitor their progress, make sure they're doing well with their medications and their vision and everything else after that. Another common condition that you may have heard of already is glaucoma. Doesn't seem like my slideshow wants to work here. Here we go. Glaucoma affects the back of the eye, the optic nerve here that we were talking about, that nerve that actually is from the brain that plugs into the eye. And one of the common ways we know glaucoma develops is the pressure, the fluid pressure inside the eye can develop. Tricky thing about glaucoma is the most common form of glaucoma that we call primary open-angle glaucoma is actually silent. We call it a silent disease because there's no obvious symptoms to the patient. There's no pain, there's no redness, there's no obvious loss of vision. Just the obvious things that we would think about with an eye disease don't actually happen with glaucoma. What it does is, as that nerve in the back of the eye is slowly damaged and nerve fibers die off, what'll happen is our peripheral vision is actually lost very, very slowly for most people. And you lose one little pixel at a time. So a lot of times I'll have a patient in the chair, and this is what you would hear if you were sitting with me in the exam room. I would say, you know what, Mr. or Mrs. Smith, I see that the pressure in your eyes seems a little high, or perhaps your optic nerve is showing some changes. We need to monitor a little more closely for glaucoma. And the patient will ask, oh, I've heard of glaucoma. What is that? Glaucoma is a condition that tends to affect our peripheral vision. And they'll almost, 9 times out of 10, they go, oh, my peripheral vision is totally fine, right? I can see my hands out here. Yeah, I get it. That's fine. As far as gross assessment, peripheral vision is perfectly fine for those early onset glaucoma patients. But there are little pixels that are lost over time. And one of the tricky ones is our peripheral vision is not just out here. If you close one eye, this is also your peripheral vision for this eye. And what will often happen is you have both eyes open, your right eye will compensate for that nasal field of your left eye and vice versa. And I've had a lot of patients over the years, even young patients, young meaning, people in their 40s, who will come in and say, what's really weird is over the last few weeks, when I close one eye, this is blurry over here. And it turns out that they have glaucoma, and it's just something that has crept up. And that's why we have to be extra careful with glaucoma, especially if it's affecting the nasal field. Patients don't even know that they have it for a long time. And once that vision's gone, we can't get it back. That's the scary thing about glaucoma, is the vision loss is permanent. So we like to be very diligent. If we feel anybody has any signs of glaucoma, whether their ocular pressure is a little high or whether the optic nerve is showing some potential signs of change, we get them into a little bit of a protocol right away, where we kind of just get them into the system of making sure we're checking up on them regularly to look for any potential changes over time. And here's a little graphic of, how glaucoma could affect our vision. And again, early glaucoma, you don't even notice it, but up here in the corners, there's some loss of vision, and over time, it'll potentially take you down to tunnel vision. Kind of like that vignette filter on Instagram. All right, what's next? We have a systemic condition that I want to talk about. So this is what I wanted to get into a little bit more detail with you guys, is the fact that we have to always keep in mind that our eyes are connected to the rest of our body, right? And we think about optometry or even ophthalmology as a profession that is just treating the eyes. But a lot of our work is actually talking about how our eyes are related to the rest of the body and potentially picking up systemic conditions. So diabetes is the biggest one. So what can happen with diabetes? Of course, you probably know well that diabetes causes our blood sugar levels to increase, potentially due to insulin resistance. Type 1 diabetes, of course, there's no insulin being produced. In type 2 diabetes, we develop insulin resistance. In either case, blood sugars are higher in the bloodstream. And what that means in our eye is that the junctions in the blood vessels, and this is specifically in the retinal blood vessels, but if we see it in the eye, it'll happen other places in the body as well. But the junctions that hold the blood vessel walls tight, they start to loosen due to that increased blood sugar. And it loosens up and weakens the blood vessel walls. And it can cause leakage of fluid in the back of the eye. And over time, as you can kind of see in this graphic on the right side, you can see that we'll get leakage of fluid and blood, and we'll get bleeding and other deposits in the back of the eye. And this is something that in the early stages may not affect vision, but depending on how much swelling we get, depending on how much fluid is built up in certain parts of the eye, it can cause permanent vision loss. It can cause even some more severe conditions like retinal detachments and even total vision loss in some cases. So it's really a big deal for us to look for diabetes. And one of the cool things is there's multiple studies that have shown that a detailed eye exam, a dilated eye exam, can in fact pick up changes in diabetes before even blood tests can. So the standard of care for blood diabetes is you're going to go get your blood work done every 3 months. They're going to check your glucose levels, your A1C, and see where it's at. But a lot of times, what we can see in the exam room is the blood vessels, the retinal arteries and veins, specifically the veins, are showing changes due to fluctuations in blood sugar. And I've even seen patients who didn't know they had diabetes. They come in saying, I'm completely healthy, I have no medications, everything's great. And we take a look in their eye, and it usually won't look quite this bad, but we'll see changes in the blood vessels, we'll see leakage of fluid, and I'll tell the patient, you know what, this is pretty typical for diabetes, and we need to get you checked out. And in a majority of the times it is diabetes if this is what it looks like. Now this is very advanced. This is what we'd call severe non-proliferative diabetic retinopathy. There's obviously a lot of red spots everywhere, a lot of white, yellow spots in the middle compared to the picture on the left-hand side, the normal retina. But this is kind of thing that we're looking for. In many cases, we'll just see a couple of little specks kind of somewhere scattered around the retina, and that's enough for us to kind of be on more heightened alert. There's some pretty rewarding experiences that I've had with patients like this. Again, a patient that didn't know that she had any systemic conditions, but she knew that she was out of shape or overweight. She was aware of that. She kind of told me, I've gained some weight and I'm trying to lose this weight and blah, blah, blah. And, we did the eye exam and I saw changes in the back of her eye. And I told her, look, you have what looks like diabetes. You have to go get checked out. And what actually happened, this was a more significant case. It turned out to be, in her case, it wasn't diabetes. That was actually hypertension. But I'm going to talk a little bit about hypertension in a second. But in any case, she went to her doctor was off. It was a really strange scenario. Her doctor was like on vacation or something, but I told her she should get checked out quickly. The next day or 2 days later, she started to feel lightheaded. So she was like, you know what, I'm just going to go to the ER. So she went to the ER and she practically, while she was there, practically passed out. And her blood pressure was like through the roof. It was, I don't know, she said it was like 210 over 130, 150, something crazy that you're like, how are you even standing at that point? So they got her on some treatment and all of that kind of thing. And she came back and saw me a few months later and her retina looked significantly better. And she was so grateful. She was so thankful because if she wasn't already going to the ER to get checked out, she doesn't know where she would have been when she passed out and had that moment. And since then, she dropped a ton of weight. And the cool thing about these conditions is if you really are on top of it, if you're diligent, if you're treating doing all the right things to get back into good health, our bodies are really capable of healing themselves. So you'll see a retina like this on the right-hand side, one day, and 6 months later or a year later, it'll look 50% better or even more because the patient's done a really good job of losing weight and being active and eating healthy and that type of thing. So we can really have a good impact on a patient's long-term health. So I mentioned hypertension. I wanted to quickly talk about that. I'm going to show you a much more subtle image here. So this is the type of kind of detective work we have to do with systemic conditions. So again, a picture of a retina. This is the optic nerve. I didn't touch on this or mention this yet, but you see it's kind of subtle in this picture. I'll go back because I want to show you in this picture here. You see it's very obvious here, this dark spot right in the center. This is the macula. That's the very center of our eye. That's where we get our central vision and color vision. And we like that dark color that you see. It's very defined, as you can see there. This is obviously the retina of a very young person. But that is the part of the eye where we get our central vision. So as you can see in this image, all this yellow spots here indicate that there's been leakage of fluid here and deposits of protein and fat and things like that. If that happens in the central portion here, your central vision goes very blurry, very distorted. And if it's not dealt with quickly, it scars. And then that vision is almost completely lost, or it'll stay distorted permanently. So one of the reasons that we have to be extra careful, excuse me. So I just wanted to, I forgot to mention about the macula. It's a little subtle in this picture, but here we want to focus on the blood vessels. So this is one of those patients that we'll have come in who maybe doesn't even know they have hypertension. We can look at, you can see where the arrows are pointing at these blood vessels. In hypertension, the arteries, which are these lighter vessels here, will tend to go skinnier, and they tend to get more straight and narrow, essentially. Instead of having a nice kind of arcing, wavy pattern. The arteries are usually thinner than the veins. We know that, that's fine. But what we'll see here, as you can see with these veins that are going nasally, these are quite a bit thinner, these arteries. Sorry if I said veins. And that is an early indication of hypertension. And that's because the muscles in the vessel walls are constricted, as you can expect they would be in hypertension, and they're making those vessels go narrower. And again, if we're seeing it in the eye, it's likely happening somewhere else, in some other important organs, like the brain and the heart, of course. And over here, you can see these two blood vessels crossing over each other. And that's the artery, the lighter colored vessel, crossing over the vein, which is a darker one. And I wish I could zoom in on this for you guys, but you may be able to see that the vein is kind of getting pinched there. It's almost disappearing under that artery. And that's one of those subtle signs that tells us, okay, this person's hypertensive, and potentially this is like, you know, a little bit beyond mild, maybe mild to moderate. We don't see any bleeding or leakage yet, but when you get a blockage in a vein like this, where, you know, really heading down the track of what we call a retinal vein occlusion. And a retinal vein occlusion can be a pretty serious thing where, as the words, you know, as the phrase will indicate, that vein is occluded or blocked. We get a backup of fluid, and eventually the vein can't hold that fluid anymore and it leaks. And that can cause a lot of bleeding and swelling in the back of the eye. So hypertension could also lead to pretty significant ocular changes. So we watch for that quite closely as well. And we look for these types of subtle symptoms and subtle, signs, even when patients are asymptomatic. So again, in a patient like this, I would say, you know, Mr. and Mrs. Smith, it's looking like there's some changes related to blood, you know, high blood pressure. You should just go talk to your doctor, get some tests done. And I'd say 8 times out of 10, this is hypertension. This could also be like, sometimes people are a little bit predisposed to having little changes like this, but majority of the time it's actually going to be due to high blood pressure. And you know what often happens a lot of times here is a patient will tell me they're not on any medications, they don't have any issues, and we'll go through all of this. And at the end of the exam, we'll show this picture and I'll say, look, we're seeing these changes. We call this nicking of the blood vessels. This is related to hypertension. Oh yeah. Well, my doctor did tell me it was riding a little high. Okay, good. What? You don't want to call it hypertension. You're just going to call it your blood pressure is riding a little high. Either way, we got to watch this a little bit more closely. Okay, I think we're getting closer to the end here. Yes, okay, so I wanted to talk on one more significant condition. Again, I skipped over a lot of the simpler conditions that we are going to see day to day. Like every single day, I'm going to see pink eye. I'm going to see allergies. I'm going to see the eye infections. Yesterday I had to dig metal out of 2 people's eyes, right? And that kind of stuff we see very regularly. This is the kind of stuff that we have to always be on the lookout for. We're always looking for every single patient. We're looking for this stuff. It's not like I just scan the retina. I don't think about hypertension if the patient tells me they're not on hypertensive medications. I'm always looking for it. And you know, you've probably heard a story about a brain tumor being detected through an eye exam. It's not very common, but unfortunately, it's more common than you might think. I've personally had 3 patients. Now that's in 10 years, but my practice is not exactly the type of practice where a lot of these patients will come through, but I've had 3 who have had brain tumors. Ultimately, I was not the one to diagnose it. I was picking up those initial signs and then sent them to the right person who could officially diagnose it. But there's different types of brain tumors. And again, you probably already figured this out. The specific part of the eye that we're going to look for these types of changes is the optic nerve, because that is a part of the brain that connects to the eye. So we're not going to go through the entire optic tract here, but you can just see this is the optic nerve that leaves the back of the eye. And then there's multiple places where these changes could potentially happen. And one of the common ones is the pituitary gland, which sits just behind the eyes, right in the middle. And that's letter B here is indicating a pituitary tumor. And what you would see is, I can't see my entire screen here, bilateral what we call hemianopsia, where you get, if it's dead center, you lose the half of your visual field on both sides, outside of your temporal visual field on both sides. If it were to happen at A here, where it happens right behind the eye, then you just lose vision entirely, or most of the vision in that one eye. So we do these tests called a visual field, where we can evaluate a person's visual field and see, is it a quadrant that's missing? Is it the, half of the visual field that's missing? And it helps us deduce where the, oh my God, I'm losing the word, but where the inflammation or the injury or tumor or whatever it might be, aneurysm might be placed. And these are the types of things that we'd be looking for. So the optic nerve gives us a ton of information. There's another condition we can look for is inflammation of the optic nerve, optic neuritis, which could also indicate potentially MS. I can't remember what the number is. It's a very high percentage of MS, initial diagnosis for MS that is initially detected through the optic nerve. So again, we're looking for inflammation at the nerve here. And something I just want to quickly point out, hopefully you guys can pick these up. I should have switched these images around, but you see on the left side here, we have a very healthy optic nerve. We have a very defined edge to the nerve. You can see where the nerve ends and the rest of the retina begins. Whereas on this side, the nerve just sort of looks like it's spilling out. It's sort of, the edges are a bit more blurred. This nerve is swollen. This is actually a little bit more subtle. In some cases, the nerve just looks like it's bulging out. And that could be due to a tumor in behind the eye. There's also something that we call idiopathic intracranial hypertension. So basically, the intracranial pressure is high. There's no tumor, but it mimics a tumor. For some reason, the intracranial pressure is high, the cerebrospinal fluid pressure is high, and it causes the nerve to look swollen like that. And that's something we have to get a differential diagnosis by a neurologist, of course. In some cases, it's not a tumor. So these are the types of things that we are looking for on a day-to-day basis. I hope that those cases, those images were helpful for you guys. I just wanted to share a few kind of final words when it comes to selecting a profession and, determining whether the profession is right for you. And I'll give you my personal experience on this. So when I was in second or third year of undergrad, it was third year because my first 2 years of undergrad were not very good. I'm going to be very honest. I was not doing great. But in my third year, I think it was just in the beginning, I kind of decided, okay, I got to decide what am I going to do after undergrad here. And so I started volunteering, just like you guys are trying to do here, shadowing and talking, more importantly, having conversations. It's one thing, it's kind of nice to know what happens in the exam room and what the day-to-day is, but having conversations with the practitioners, and that was an optometrist, a medical doctor, pharmacist, physiotherapist, chiropractor, all of, you can name them, I talked to all of them. And I got an idea of what they do day to day, but I also got an idea of how they felt about their job and their personalities. And I determined that optometry was the one that really fit my personality. Tend to be a bit more of a laid back person, not very type A, not super detail oriented, although you have to be a little bit to get through, graduate school and everything. But relative to other positions, other medical professions, I was pretty chill. And I like the idea of having a conversation with my patient. You spend 20 minutes or so with a patient. I like to be like, hey, how you doing today? How's it going since last time? I'll make a note in the chart about what they were doing last year or the 2 years ago. And like, how did that thing go? And with kids, I'll ask about how their sports are doing. I like having those conversations in the midst of the eye exam. And the optometrist that I ultimately kind of give credit to for me going into optometry here in Vancouver is Dr. Pawa. And he's much older, but at the time I was watching him and he was just chatting. I felt like he was just having a conversation with his patient. And 15 minutes later, he's like, wow, you're all done. Your eyes are healthy. Here's your prescription. I was like, wow, that was an eye exam? That felt more like, a couple of friends catching up, just had a phoropter in between them for a couple of minutes. So I felt like that really fit my personality. You know, a colleague of mine is really into psychology and things like that. And he talks about how most optometrists, if you know much about personality tests and things like that, the Myers-Briggs, you know, the ISFJ is the sort of the giver, the carer, the person who wants to just help other people. I feel like most people go into medical professions are those people, but the optometrist is much more of that, like not aggressive, just wants to help out, kind of do the good right thing. And you know, so you want to analyze that a little bit about who are you, where do you want to see yourself in 10 or 20 years from now, and does this profession kind of fit where you'd like to be? The other thing is, I don't think I wrote it on here, but you know, most professions, most of the time we think about just what happens in the profession, what happens in the four walls of that clinic or business. We have blinders on and we just think, okay, well, this is going to be my life for the next 20, 30, 40 years. But most professions, and optometry definitely is one of those, will give you the opportunity, if you look for it, to expand and do different things. I talked about in the beginning about fulfillment and doing things like volunteering that give you fulfillment. Whatever profession you end up in, look for those opportunities, okay? Because otherwise you'll find eventually you kind of get a little bored or you're in a rut and you find things monotonous. Do things, different things to keep yourself entertained and engaged and you know, help other people on different levels. And that will definitely keep you feeling fresh. There are a lot now these days compared to when I went to optometry school. There's a ton of online resources. You know, one that comes to mind is they just changed their name, but they used to go by Covalent Careers or New Grad Optometry. I think they're called Eyes on Eye Care now, and they got tons. And I can't even tell you how much of an online resource they have. Articles written by experienced optometrists, brand new optometrists. I think even students. Yeah, there's students who write articles on there about their experiences and you know, super helpful. So check out Eyes on Eye Care. And they got lots and lots of resources, and even things like they'll do studies and they'll take surveys, and they'll break down like per, you know, for each optometry school, how much enrollment they had, what is the tuition, what is the cost of living in the city, and all these other things. Really going to be helpful for you as you're kind of narrowing it down. Actually, I'll go back to the personality thing for a second. When you're looking for a school that you want to go to, also keep in mind personality, your personality, and how it will fit with the school and the city. So when it came down to my last two choices, I narrowed it down to two choices that I was going to go to optometry school. One was Pacific University in Oregon, and the other one was New England College of Optometry in Boston. And I have personally always lived in or near a city, right? I was born in London, England, obviously busy city. Then when I was 10 or 12 years old, we moved to Vancouver, and we always lived near the core of the city in Vancouver, not in the outskirts or suburbs, or, you know, my wife grew up in way out in the burbs, and her family actually owns a farm. So she's got a very different perspective of kind of what an upbringing is and what kind of like comfortable living is, right? I'm like, I want to be near the hustle and bustle. The Pacific University School is in Forest Grove, which is a tiny little town that's about 45 minutes outside of Portland. So when I went there, I was like, this is beautiful, but it's not for me. When I went to Boston, I was like, wow, Fenway Park, you know, hockey, went to the Patriots games and all these things. I'm a big sports fan. It was really the thing for me. So take those things into account, because your life outside of school is still really important, even though you're going to be studying a good chunk of time. Keep those things in mind, right? You still want to be able to enjoy your life in the way that you like to enjoy your life. Whether that means to be, you know, super quiet and at peace and out in nature, or whether that means to be in a city and go to big sporting events. Take those things into account. Most of the schools really are really good schools. I don't think I've met anyone that I've said, wow, which school did you go to? Because you're not a very good optometrist. You know what I mean? Most of the time, once you graduated, you got all the skills you need under your belt. But you could also talk, you know, ask the schools or do a bit of research about which school is a little stronger in which area. So for example, New England College of Optometry has had at least a reputation of being stronger in the clinical side of things. Their academic reputation wasn't quite as good, although it has improved over time, whereas somebody like a place like, not to say that Berkeley's clinical program is not very good, but they're really well known, or it used to be anyways, for the academic side of things, right? So you kind of find what aligns with you a little bit more. Again, I'm somebody who likes to be more hands-on, and in the clinic, we were observing in clinic, I think even maybe in our first year, but definitely by second year, which was very early, for most schools. When you're going through this process, whether you're looking before you go to optometry school or while you're in optometry school and you're thinking about after school, definitely connect with professional associations. And this is actually with no matter what profession you end up in. So for me, while I was in optometry school, I connected with our BC Doctors of Optometry, which is our association here in British Columbia. And they have a student membership that they just kind of keep you in the loop with what's happening in the profession. And when you graduate, when you become a professional, make sure you get involved with your professional association. Most of your connections, most of your opportunities are going to come through those connections that you make at the association. There's so many like-minded people trying to build a profession up, trying to move it forward. So just try to be involved however much you can. And you guys are already doing this. Reach out to practitioners. Get comfortable. When somebody emails me, one of the first things I say is, hey, good for you for taking the initiative to call me or email me. I try my best. Most of us are a little bit busy, but we'll try our best to help out as much as we can. Don't be discouraged if somebody doesn't answer your call or your email, or maybe they answered and then they didn't for a while. I've been guilty of having stuff kind of get lost in the inbox, but overcome that little bit of that fear and get out there and start calling people or emailing people. That's actually how I've kind of progressed throughout my career. Even now, if I need some help on something, I'll just call someone I've never met before and be like, hey, I'm so-and-so from wherever, I need help on this thing. Do you mind helping? And I'm finding, with social media and stuff like that, it's a little easier to do that. I have people reaching out to me as well. It's a really great way to build a community. It's a really great way to get, boost your career as well. Okay, I think that's everything. I have not looked at the chat, so I don't know if there's any questions. Happy to take them now if there are any.
Yeah, so we've been taking note of all the questions in the chat, so we can just go ahead and ask them to you orally if that sounds good.
Yeah, great.
And then also I encourage any students here, if you want to ask a question directly, you can utilize the raise hand function and we can call on you so you can unmute yourself and ask your question. Okay, but thank you so much for that presentation. That was wonderful. I think something that I was wondering about, and this what our students were too, can you speak more about your experiences with travel and providing services in disadvantaged communities and in other countries and how that might have affected your career?
Well, absolutely. I'm always happy to talk about that. So I had always kind of just been looking for these opportunities. As long as you just keep an eye out for them, they tend to show up eventually. But if you want to be more involved, just start searching. It's easy these days with Google, of course. You can just search like volunteer eye care and stuff like that, and then most of the organizations will pop up. But the big one that I've been involved in is OneSight. OneSight is a huge organization. They do clinics across the world on most continents. The first clinic I did was in South America in 2015. We went to a remote town in Colombia, and that was really it was life-changing, just to see how people are living and, the lack of resources that they specifically had in that town and how grateful they were for us to do something. I do eye exams all day long, every day. But I don't get people hugging me and giving me gifts and doing that kind of stuff day to day here because we're used to it. We're accustomed to it. We take it for granted to some degree. Whereas when you go somewhere like that, it really opens your eyes, pardon the pun, to how fortunate we are to have access to the things that we have access to here, and how appreciative people out there are. And that was, again, pardon the pun, magnified when I went to Jordan. Now it's been 2 years, in 2019, because that was the Colombia experience, but to another level, right? We were seeing refugees who had been displaced, who really had nothing, literally nothing at this point. They had to leave everything behind. People were waiting in line, a mother with 2 young children was waiting in line for 8 hours to get an eye exam. I was just I wanted to go out and just bring all the people in and give them as many eye exams as quickly as I can. But we had a system, of course, which was more efficient than what I was trying to do. You just feel bad. You're like, holy cow, I wouldn't wait 8 hours anywhere I have 2 little kids too. I understand how hard that is. I wouldn't want to wait somewhere outside for that long just to get an eye exam, but the kids needed the little kids needed glasses, the mom needed glasses. Like they couldn't see anything unless they had their glasses on. And we saw people who had ridiculous prescriptions that like here, you know, they would be under the care of a specialist or something else. And out there, they had nothing. So just really, it really was life-changing. Totally changes your understanding of how the world works. We tend to get comfortable with where we are and what we have now. And we live in our little bubble as much as we would like to think that we are, you know, worldly and experienced and have, you know, lots of things that we've done, until you've done something like that and gone into an area where you see people who have much less than what we have. You don't understand how much we should be grateful for. So if you're an optometrist or you're in eye care and you want to get involved, so definitely One Sight is an easy one, just literally onesight.org. Another one is Optometry Giving Site, great organization. I've never volunteered with them, but I do fundraising for them and donate to them. And then there's probably lots of local organizations wherever you live, like look them up. As I said, here in Vancouver, we have one called the Eyeglasses Project, and most major cities will have something similar. Hope that answers your question.
Thank you so much
Thank
for
you.
that insight. Yeah, that was amazing. But as I and many other students who are going into the pre-medical field or pre-dental or other healthcare professions, we're worrying about the fact that you mentioned about 50% of future generations could develop myopia.
Mm-hmm.
And so what is your take on that? Like, is it too much of screen time?
Mm-hmm.
Should we be eating carrots more? And how has this been affecting how you raise your daughter, who had just turned 1 about a year ago?
Yeah. So the screen time thing is definitely relevant. There's a very obvious trend from roughly when the iPhone and the iPad were invented and released, and the increase in myopia kind of spiking. It was increasing already, and then it just sort of like shot up. And it's not Apple's fault, but it's technology around that time, right? The amount of screens that we now have in front of us, kids, and so much of what kids do is on a phone or a tablet. And especially now with COVID, I mean, kids are being homeschooled, they're on laptops and things all day long. The screen itself is part of the problem. The majority of the problem is the fact that it's something close up. So our bodies are very good at adapting. And if you spend most of your time indoors and you're looking at stuff that's closer up, our human genetics are telling us that we should adapt to this environment to be more efficient in this environment, right? So that's what we see, and it clearly happens quite quickly. You know, one generation and all of a sudden myopia has jumped up. But we've seen, you know, if you go back 20, 30, 40 years, you see there was a spike then too. And that was when like the office job, the desk job really became more common. You know, when we shifted from working more outdoors to working more indoors, there was a spike in myopia as well. And again, it's just our adaptation to our environment. So part of myopia is genetics. That line is going to slightly increase, even if we all spent time outdoors all the time. That line would just slowly increase because with genetics like that, the prevalence would slowly increase. But the fact that we spend most of our time indoors is speeding up that process quite significantly. You know, in sort of relevant to that is that one of the number one things we suggest to kids is spend more time outdoors. Spend an hour outside every single day. And that is because UV light is actually quite beneficial. As much as we tell people to wear sunglasses, UV light is quite beneficial for ocular development. But also when you're outdoors, you tend to just look at stuff far away. And again, our body will try to adapt to that, being able to look far away. So the carrot thing, I want to just share something really quickly with you. So it's funny you mentioned that, and I understand that you mentioned it because we all talk about carrots being good for our eyes. So carrots have a lot of vitamin A. Vitamin A is good for your eyes, but there are other vegetables that have higher concentrations of vitamin A, like kale and spinach and broccoli and stuff like that. So vitamin A is good, but that's good for retinal health. The carrot myth came from World War II, and the British had just developed radar, and they were able to pick out the German planes from the sky at night. And everybody's like, wow, how are you guys able to shoot down these planes? How do you know where they are? And they didn't want to let the Germans know that they had this radar. They didn't want them to know they had this technology. So they made up the excuse or the myth that they were feeding their soldiers carrots to give them better night vision. So that's where, if you hadn't heard that one already, that's where the carrot myth came from. But keep eating carrots, is good for you. And then the last thing you asked about my daughter. So my older daughter is turning 4 soon, and she actually has glasses, but she's not nearsighted. So she's farsighted, and that's much more of a genetic thing. That's sort of a predetermined. One eye is a little smaller than the other. It's not like you could tell by looking at her, but it's like a millimeter smaller. But that makes her eyes have to work a lot harder. So unfortunately, she had to get glasses just a couple months ago. So it finally hit home for me what it feels like to prescribe a child glasses and what a parent feels.
Wow, thank you for sharing that, and especially the carrot thing. I didn't know that.
Yeah, fun fact of the
but
day.
now I feel, yeah, right. I feel so much more prepared to be going into the medical profession now. Kylie, or I'm sorry, I hope I said your name right. You can go ahead and ask your question.
You did say it right. My question was blue light glasses. What are your thoughts on blue light glasses when we're on computers and phones all the time doing schoolwork?
Okay. Blue light glasses. Personally, I feel like they're beneficial, but I think it's really important to be aware of what the benefits are. So unfortunately, for a long time, they were, I think, being people were being what's the right word? Oh my gosh, my brain is like fogging over now. Misinformation essentially was the problem, right? So a lot of people who were selling blue light glasses were making claims that were not founded. The science is a little bit muddy on, for example, they reduce the risk of macular degeneration. Some people were even saying that they reduce the risk of cancer. So if you're going to look at that kind of stuff, I wouldn't look at blue light glasses as being some kind of magical health fix. But what they do, I believe, help with, there's 2 things. One is blue light can be uncomfortable for our eyes. I'm not going to say harmful, but uncomfortable, because it's a higher energy light. In the spectrum of light, it's shorter wavelength. So it absorbs deeper into our eyes. It's harder for our eyes to absorb. It can cause a little more strain and fatigue. But the other thing we know about blue light is it can affect our circadian rhythm. We experience blue light when we go out in the sun. There's blue light in sunlight, and that's helpful for our circadian rhythm to know that it's daytime. But at nighttime, we shouldn't be exposed to any blue light. But when you're in front of a computer screen or a phone, your eyes are absorbing this blue light. It can throw your circadian rhythm off. So for those reasons, blue light glasses can be quite helpful to potentially improve sleep, improve the circadian rhythm, and hopefully improve eye strain and that type of stuff. I personally wear them. I'm not wearing them now because I just had the turban tied and they don't fit, but like normally I'm wearing glasses with blue light filters on them. So at work, I'm always wearing them as well.
All right, thank you, Dr. Sian. An audience member has a question for you. So if Yulia can speak up and ask her question, please.
Thank you. Dr. Sian, I remember in your Instagram, you mentioned the Myosmart Lens. Do you think you could describe a bit more how it works?
Sure, yeah. Hi, Yulia. The Myosmart lens is made for myopia control. So I mentioned myopia is on the rise. Myopia control is one area of optometry that's really growing now as there's more tools at our disposal to help slow down the progression of myopia. So Myosmart is a lens. Lenses before they go into your glasses, they're just round. They look like a really thin hockey puck. And so the Myosmart lens has a really small central portion that is just the regular prescription. So if you're -3, for example, it'll be -3 right in the center. And around that, there are these little changes in prescription that deliberately cause what we call peripheral defocus. So centrally, when you look straight ahead at something, that's clear, but around that, and it's not like super perceptible. It's not that you can say, oh, my vision's super blurry in the periphery. But what the science has shown is if we induce peripheral defocus, it, for some reason or another, sends a signal to the brain, to the body, to stop the growth or elongation of the eye. The reason for increased myopia is increased axial elongation or elongation of the eye. So when we do this peripheral defocus, it, for some reason or other, tells the eye to stop growing. And then that would eventually, in the long term, decrease the progression of myopia.
It's pretty incredible.
Yeah, pretty cool.
Thank you. Yeah, that was really cool. So another question we had was, I know you said you didn't necessarily want to spend so much time on this, but I think it's really important to kind of mention more about your identity as a minority and maybe how that's affected your experience as a professional, as a student, and just maybe interacting with patients, and how maybe that has made your ability to connect or maybe not be able to connect with certain populations different.
Sure. First of all, should I stop sharing my screen? I just realized I don't need to have this on here, right? I can see your guys' faces now. This is better. Great question. My experience has been kind of interesting. So for an East Indian person or a South Asian person, I have relatively fair skin, as you can probably tell. So, a lot of my family and friends who are, of Indian descent are darker skin. And so since I was a kid, I've actually been mistaken for like all sorts of different backgrounds. It almost depends. It's actually not almost, it actually depends on where I am geographically. And I'll get a different answer from someone. So a lot of times growing up as a kid, people would think I was like maybe mixed, like half, Indian, half Caucasian or something. When I was studying in Boston, people used to think I was Cuban. When I was down in Florida, I used to get something like Cuban or some others, South American. When I work here in Vancouver, depending even in smaller regions like this, so certain area of Vancouver has a higher population of Iranian or Persian people. And when I work in North Vancouver, people come in and start speaking Farsi to me because they think I'm Persian. When I work in Abbotsford, there's a higher concentration of South Asian. The funny thing is, like I'll have a Punjabi patient come in and they won't realize that I'm Punjabi. So they won't speak Punjabi to me. But when I'm in the US, people speak to me in Spanish or something else. But it's such a funny experience. So my experience has been very unique in that regard. So to be honest, I can't say that I have personally experienced a lot, not in my adult life, any kind of prejudice or I've been very fortunate not to, racism and things like that. If I have, it's minimal and I don't recall it. But the reason that, for example, that I'm starting to tie the turban from time to time is because I understand that many of my family and friends have, endured a lot of that. Over the years, I've witnessed it, right? And my older cousin, who's like my big brother, he's tied a turban his whole life, and I've seen it with him. I've seen it with some of his friends, some of my friends, going through the airport or wherever it might be, just with people on the street. And so one thing I wanted to do was try to walk a day or two in their shoes, in a sense, right? Maybe you can't tell when I don't have a turban on, you can't tell what race I am, but when I have a turban on, I'm from a certain part of the world. You can assume anyways. And so I'm interested to see how that affects people's behavior towards me or my experiences in the world. And, I'm trying to help share, I'm trying to just help as much as possible to make everybody comfortable with this, the different races and the different people that we interact with on a daily basis. I want that to be as normal as possible for everyone. And if I can help make it normalize it a little bit for my culture, then I'm happy to do my part.
Thank you for that insight. Like your presentation has given us a new view and perspective on optometry, like no pun intended there. So with your practice being extensive, being in Canada and working with people and going to school in the US, do you see a difference in optometry in both countries?
Yeah, absolutely. And I should have touched on this in the presentation, so thank you for asking. There is a significant difference. So unfortunately in Canada, our scope of practice is not nearly as broad as it is in the US. So when, in school, I was trained to treat a bunch of different diseases. I even had the option to potentially do injectables and things like that, which I know a lot of schools now are doing. But back then it was like an additional course that you could take. But I knew when I came home, there's no chance I'm sticking a needle in any part of their body. So I'm not going to bother doing that. But like I can't treat Glaucoma, I can't prescribe oral medications. You know, there's a bunch of stuff I cannot do here that I would be able to do in the US. It's getting better. It's slowly improving. The scope is broadening with time, not nearly at the pace as what it is in the US. I'm so impressed in the US and different states, the different things that practitioners can do. Prescribing oral medications, I think even potentially narcotics, but that's really not that important, but doing small procedures, you know, lid procedures, injectables, things like that, even laser procedures in a couple of states, you know, really, really cool how the profession's grown there. But that's important to know. You know, if you're Canadian and you're planning to come back to Canada after you've gone to school in the US, there will be a narrower scope of practice. But that's where it helps to specialize in some of the areas that we can practice. For example, myopia control and dry eye and things like that. It gives you a little bit of an edge, you know, versus the person who's doing the standard general practice.
Thank you. I know a lot of people today had some questions about what you think makes somebody a competitive applicant for getting into medical schools or whatever kind of graduate program they're going into, and maybe what advice you have from your own experience in trying to get into those programs, and then in particular in times like COVID, how you think people should do their best to get the experience and the knowledge they need.
Yeah. Yeah, it is a tough time for you guys. I do feel for you because you're not able to get in there and get hands-on or in-person experience the same way. But in general, my advice would be to be as well-rounded of an applicant as you can be. Obviously, the first thing we think about is our GPA, right? And we look at our grades and whatnot. I had a very poor GPA after my second year of undergrad. I literally was hovering around 2.0. It was in my third and fourth year that I finally kind of pulled my socks up and started getting the grades that I should get. But even when I applied to optometry school, I think I was technically just below what they considered their entry level. I don't know, like it was like 3.3 and I think I had 3.25 or something like that. Or maybe it was a little higher, but I can't remember what it was. But I was actually below what was written on the website and stuff. So GPA matters, but obviously it doesn't matter as much, right? If I got in with the GPA that, that was below what they had listed on their website, there's obviously other factors that matter. So volunteering, showing dedication to the profession that you're about to go into is important. So for example, when they're asking me, I don't know where this came from, to be honest with you, when I was back there, I guess I just decided I'm going to optometry, I'm just going to go all in, right? So I talked about wanting to be an ambassador for the profession. I wanted to give back. I wanted to volunteer, and I'm doing all those things now. So I feel like I'm walking the walk, but showing in some capacity that you're dedicated to that profession to make it better as a whole. And then understanding the kind of where the profession has come from and where it's heading. So for us in eye care, there's a lot of e-commerce, there's a lot of digitization of stuff for people trying to do online refractions and things like that, and understanding what the impact of that's going to be on the profession. And you learn that by doing some research, you learn that by talking to people in the profession like you're doing now. And then, again, just being well-rounded, showing that you do other stuff other than school. Maybe you work, maybe you play sports, maybe you volunteer, whatever it might be. I think it's so important to just be well-rounded, more than just having 4.0.
Yeah, for sure. And with that, we are at the end of our time. Is there any final words that you'd like to give us? I know you just kind of wrapped up like any advice that you'd like to give us, but any final words that you'd like to say to our pre-L students here today?
I think the fact that you guys are here is huge. Honestly, I think this shows that you guys have the initiative, you have the drive to succeed, to do the little things that need to be done, and just keep believing in yourself. Like I told you, my GPA was really low, and I literally had advisors at undergrad be like, it's probably too late for you to think about like graduate school and stuff. You know what I mean? It's like, yeah, just kind of figure out what other job you can get. And if you work hard, obviously, I don't want to sound too generic and too like cliche, but like keep hustling, keep working at it, keep doing the little things. If you have an idea, if you think there's something that you could do that might help you or might work out in some capacity, just follow that little lead, you know, just do the little thing that you think, just get over that first little hump, send the email, send the text, make the call, whatever, even if it scares you out of your pants, just do it. And I think you'll love that. Every time you do one of those things, you get a little rush, right? And you keep going and you keep doing the next thing. And eventually you'll look back a few years from now and be like, wow, look how far I came. Look at all those things I did that I never thought I could do. So just keep pushing your boundaries. I think you guys are all doing really well.
That is so encouraging to hear. Thank you so much for sharing that. And thank you so much for this wonderful presentation and all your great insights and discussion points you brought up today.
Thank you. Thanks for having me.
Yeah, it's been amazing. I will share a final presentation wrap up. Dr. Sian, thank you so much. If you want to disconnect from the call, you're welcome to do so. For my students here today, stick around. We'll get you situated with the post-shadowing quiz. Thank you so much for listening with us today.
Take care, guys.
We like to encourage everybody here to reflect on the session today. This is great for any applications that you might be filling out in the future. So some questions that are great to think about are: what brought you here to today's session? What are 3 major takeaways that you got from this presentation? And what would you want to learn more about? This writing or reflection is not required. However, we encourage you to submit it to our website for publication, for recognition of your hard work and to enhance your future applications. So again, that link for submitting articles or reflections will be submitted in the chat. If you want to get more involved with pre-health shadowing, we have multiple ways for you to get involved. The first is as a student volunteer. We have asynchronous volunteer tasks that you can get certified volunteer hours through professional nominations and other tasks. We're also accepting team member applications. If you want to take more one-on-one initiative in our organization, you can lead projects and initiatives and be up here with us, leading Zoom calls with us. Once again, we are humbly asking that if you're financially able to donate, that you please consider sending a few dollars to us via Venmo or PayPal. The link to do so will be dropped in the chat as well. It only costs a few dollars to keep our program up and running and free for everybody to attend. So if you're someone who can afford to or know someone else who can, please support us by donating to our organization so we can continue to get everybody the education they deserve. Leave this up for a few seconds if you want to take a screenshot or if you'd like to access the link in the chat. Now for the part everybody's been waiting for, earning our verified certificate for shadowing hours if you attended our session today. So the first step is to go onto our website and find our professional course page, Dr. Harbir Sian. Next, you can take a quick 10-question multiple choice quiz based on the content that we learned here today. Once you start, you have 30 minutes to earn a 70% or higher on the quiz and get the certificate. We know that sometimes technology can be difficult, so for this reason, we allowed 2 attempts for you to take the assessment. If you run into any difficulties, please contact our email at info@prehealthshadowing.com. And as well as we know that our website can be a little wonky because of the high influx of students accessing it. So if it does crash, please wait about 30 minutes, 60 minutes. Our quiz is open indefinitely, but again, once you start it, you do have 30 minutes to take it. Once you pass, you can click the Finish Course button at the bottom of the professional page and download the certificate verifying your virtual shadowing hours. If you missed any part of the session or want to go back or view other sessions for that matter and get the certificates for that session, you can visit our YouTube channel and watch any of our previous recordings and find them on our professional page on our website as well. Be sure to follow us at prehealthshadowing.com on all of our social media channels, Instagram, TikTok, as well as our website and YouTube channels. We are currently booked every day throughout the following months until June for virtual shadowing sessions, and I hope to see you there soon. Thank you for joining us today. Please feel free to stick around if you have any questions for myself or other teammates in the call. We will be happy to answer them. This shadowing session is officially over. Have a wonderful day, everybody.